Welcome back into the Mississippi Kidney Foundation Kidney Cares podcast. I'm your host, TJ Mayfield, the executive director here at the Mississippi Kidney Foundation. So excited. Once again, we want to reach out to all of the kidney patients in the state of Mississippi. Of course, I was once in those shoes, doing dialysis every night. I know some of you may be listening to this while you do dialysis, but we're so excited to have this podcast. And one of the reasons that we have this podcast is due to our special guest today, Dr. Natasha Avery. She works with Alliant Health Solutions, and Alliant, who thankfully enough, they are the lead sponsor on this podcast. So we always thank Alliant, everybody who works at the organization for wanting to get a broader scope for kidney health in the state of Mississippi. So welcoming in Dr. Natasha Avery.
Thank you.
Glad to have you here.
Good to be here.
All right, so let's kick it off. Let's
go.
Introduce yourself to the people and just tell them a little bit about who you are.
Sure. Natasha Avery. I'm the Senior Executive Director of State and Federal Programs with Alliant Health Solutions. And what that means is that I provide a lot of oversight working with a lot of our programs that are focused at the state level, federal level, kidney disease or end-stage renal disease that comes under my work as well. So my background is in social work and public health. I've worked in a dialysis unit in the past as a social worker, been a patient services director, having that direct interaction with patients. So that's a little bit about me and my background.
And I just wanted to throw you a little bit of a curveball here. So
okay.
You said you worked as a social worker at a dialysis clinic before. Talk about the experience that you gained there from watching the patients go through what they went through and how that impacts your career today.
Sure. When I first started, and it's weird, I started out, my background, like I said, social work. I've been through all my social work classes, jobs. I knew about diabetes, hypertension, but when I saw this ad for a dialysis social worker, not even really knowing what it was, what dialysis was, I decided, okay, I'm going to interview for it. Yeah. Went for the job, and when I got there, just saw so much that I've never seen before and decided to take the position and learned so much during that time about kidney disease that I didn't know as a social worker. Previously to that job, not even really hearing a lot about dialysis, a lot about kidney disease. So that's really what sparked my interest in it, and having that one-on-one contact with patients and seeing those day-to-day experiences, those barriers and struggles, that's what got me into dialysis. That sparked my career.
Yeah, and we're going to talk a little bit more about network aid and the mental health aspect of the patients, but take people through the mentality, the mindset of the people that work through dialysis patients, and mentally how it weighs on you and your coworkers, everybody else that works in dialysis.
Yeah, you see so many and you experience so many different unique situations. The dialysis patients, they're at the facility 3 times a week, several hours when they're there. Of course, as you know, 4 to 5 hours. They really become a family to you, and you want to see these patients do well. You want to make sure people have the resources that they need. And sometimes, you take those struggles home with you,
right,
because you know what people are dealing with, and you want to be sure that there's resources out there to help, which is why I think the Mississippi Kidney Foundation is so important, because things that most people may take for granted, transportation, food, access to health care, these are some of the major barriers that dialysis patients have on a day-to-day basis.
Yeah. And you talk about all of those barriers, and Alliant, you guys do a lot of work for people that have end-stage renal disease, chronic kidney disease, as us kidney patients like to call it. So talk about Alliant and the background of the organization, and more importantly, the scope of what you guys do on a day-to-day basis.
Sure. Alliant Health Solutions, we serve patients in the Southeast. We currently are in 19 states in the nation. Of course, we have businesses throughout, but our focus is on the Southeast, these southern states. You know, our barriers and issues in the South are a little bit different
Correct.
than others. So Alliant Health Solutions has been around since the early 1970s. So a long history there. We have offices here in Mississippi, which is our end-stage renal disease network aid. We serve patients in Mississippi, Alabama, and Tennessee.
Right.
We also have an office in Texas for the end-stage renal disease network of Texas, and then our headquarters is in Atlanta, Georgia. So in a lot of different areas, but our focus is on the Southeast, and I always like to say what we believe in is making healthcare better for the people we serve. Not only do we work with dialysis patients, but we also work with nursing homes on different contracts, hospitals,
Right.
and even forming community coalitions, because we know the community ultimately plays a big role in the impact of healthcare.
Right.
A focus is on health equity.
Right.
So we do a lot, but that's just a overview of it.
Yeah. And one thing I really wanted to talk about, network aid. You know, when I took the job here at the Mississippi Kidney Foundation, a patient said, you know, have you heard of network aid? Have you considered doing work with them? Of course, I'd never heard of them. So I'm like, who is network aid? I got to find out who these people are. Yeah, you know. And so I was so excited, you know, when somebody said, you know, Dr. Natasha Avery. I was like, I've seen the name on the Mississippi Kidney Foundation board. So I'll talk about network aid and the importance of it.
Sure, and this is my baby, so I can talk all day about Network Aid.
Right.
I started with Network Aid in 2008 as the Patient Services Director, so I had that direct interaction with patients calling. Network Aid is a federally mandated program. It's national. You start with Network 1 over in the east, up in the New York area, Network 1. And it comes all the way across, and you get to Network 18, which is California. So each state has a network. Network 8 serves the states of Mississippi, Alabama, Tennessee.
Correct.
So a couple of the things that we do first, I will say one of the most important items is working with patients. We serve as a mediator for patients who may have questions about their care, patients who want to know about treatment options, patients who may be having difficulties at their facilities or issues they're trying to resolve with the staff and they can't. So we're kind of that outside person to come in and mediate the situation and try to get to a positive outcome for the patient as well as the dialysis facility, right? We also, a second component of what we do, quality improvement initiatives, and they all come from CMS, Centers for Medicare and Medicaid Services. They have the data, they look at it, they know areas for dialysis patients that we need to improve on, so they give national projects and initiatives that all 18 networks have to work on with patients, and ultimately looking at improving health outcomes for the patients we serve.
Right. With Dr. Natasha Avery of Alliant Health Solutions, for the Mississippi Kidney Care Podcast. Dr. Avery, or Natasha rather.
Natasha, yes.
Talk about the importance of education. You know, you have so many kidney patients or people going through, and they find out they have to get on dialysis, and they have so many questions, and there are so many misconceptions about dialysis and everything. And I would imagine you guys may have to calm some people down and say, hey, look, it's not going to be as bad as you think. Talk about that, even as a social worker, the importance of educating patients on dialysis and the possibility of what they'll see going through that process.
Right. So I'll back up first and say I think a lot of people don't even know about dialysis.
Right.
They know about high blood pressure, diabetes. They've heard that, know about it, know someone with those illnesses, but never know that what the result of not controlling diabetes and hypertension can lead to. That renal failure is one of those results of uncontrolled diabetes and hypertension. I always say one of the first stories that a patient said to me when they called the network was they just started dialysis, and he said, if I would have known that by not taking my blood pressure medicine, it could lead to this,
Right.
I would have done something different. And that's really profound to hear someone say that. And that's not I'm sure, TJ, you've heard people say that.
Absolutely.
Yeah, a
Absolutely.
lot. So to me, that's where education needs to come into play. We get the education about diabetes and hypertension, but then what?
Yeah.
What happens if it's not controlled?
Right.
Even when you talk about educating, if you're already on dialysis, educating your family members.
Right.
Because if you're on dialysis, that means your family members, they have an increased risk, right? For
Absolutely.
being on dialysis. So I say I like the education piece so people don't even get to dialysis.
Mm-hmm.
I would like to be out of business one day, so we don't.
You want to prevent kidney failure?
Yes,
Absolutely.
you want to prevent it. But on the other side, if you do, we have people on dialysis, right? But some of the things that we work on, Alliant Health Solutions through Network 8, is if you're on dialysis, let's make the best choices, your best treatment options. Transplantation is a major project for us, for all end-stage renal disease networks. Not only are we looking at numbers, getting patients on a transplant wait list, increasing those numbers, but also increasing the number of patients who are actually transplanted.
Right.
It's such a low percentage, so how can we increase those numbers? That's one of our projects. Also, home dialysis.
Yeah.
If you have to do dialysis, consider a home modality.
Yeah, because I did peritoneal, and I believe peritoneal dialysis saved my life because I was able to still enjoy some things throughout the day. But, when we talk about, this is a great segue, home dialysis, how many people don't understand, hey, I can do this at home, and it's a lot better on my body. I can still be active.
Quality of life.
Yeah. So the importance of that, home dialysis, just touch on that for a little bit.
Sure, and I feel a piece of that is having to dispel some of those myths.
Yeah.
That you have to have a doctor around to do dialysis. You have to have a nurse to be able to do dialysis at home, and that's not the case. You can be trained. Nobody would send a patient just out and say, here, do dialysis, right? You're going to get plenty of training. You're going to have the tools, the resources. And if you have questions, there's a nurse on call 24 hours with your dialysis center who can coach you through and help you. And they train you on it in center or in an environment doing the home, so you feel comfortable before you're actually at home by yourself doing dialysis. Not only, as you said, you brought up a good point, TJ, when you said it saved your life, it improved your quality, but it gives you a sense of independence too.
Correct.
You have control over something. It's not someone telling you, hey, be at the dialysis unit at 5 a.m.
Right.
You have to get on at this certain time. It gives you a little bit more flexibility. And true, this is a life-changing experience for anybody, but it still gives you that opportunity to enjoy some of the things you did before. Right. So it's really giving that education, making patients feel comfortable, that empowerment that, hey, this is something you can do with the right training.
Right. We thank you so much. We got the drawdown coming up. I'll be excited to see you at the drawdown.
I will be there.
Oh, yeah. I know
I'm glad we're not virtual anymore. I'm ready for it.
Not virtual anymore.
Yeah.
So we'll be back in person with the drawdown March 4th at the Country Club of Jackson. Just so excited with all the work that you're doing with Alliant. And once again, we thank you so much for the support that you guys give the Kidney Foundation. I thank you for the support that you give myself and everybody here at the Kidney Foundation as a board member. I'm just so excited that this podcast has taken off. The education that you've given people today. Who knows how that may help somebody. They may never meet you in person.
Right.
But the words that you said today could help save a life later.
I think it's education, empowerment.
Yeah.
If you're at risk or even have questions, when you go to your doctor, say, hey, can you check my kidney function? What do I need to be doing? I'm at risk. I have hypertension. I have diabetes. My grandmother is on dialysis. What does that mean to me? Right. Those are just some questions, that empowerment that we want to educate people about, and I think you're doing that, TJ, with these podcasts. So I appreciate you for doing that.
Oh, we thank you. Do you have any announcements for anything that you have going on, or for the next couple of months that you would like to see happen with Alliant?
Sure, I would just like education. We're focused on providing education to the population that we serve, asking questions. Our website, we have Network 8 has a website with a lot of resources, educational materials to help answer any questions that people may have. And as always, people can reach out to Network 8. All dialysis units should have a sign up in the units with how to contact us if you have questions, anything that we can do to help make healthcare better. That's what we want to do.
Absolutely. And we also have the Mississippi Kidney Foundation virtual support group. So for people all over the state, if you feel like you need somebody to talk to, I know that's not always an easy thing, but once again, I'm on every single call every month. I've been through it. I've been through dialysis, the medication, the mental and emotional toll that you go through, and the physical toll, of course, as well. So feel free to reach out to Network 8 or the Mississippi Kidney Foundation for any kind of mental health that we can help out with. Feel free. Natasha, we thank you again so much. Can you give me a Hell State before we go? Just one time.
Hell State. But I also went to grad school at Jackson State, so I have to say go Tigers too. So Hell State and go Tigers.
From now on, I'm winning all corn pin on every episode.
On every episode.
But thank you so much. We appreciate you. And that will do it for this episode of the Mississippi Kidney Foundation Kidney Cares podcast. Thank you again to Natasha and Alliant, our premier sponsor for this podcast. So thank you so much. And as always, we'll see you next time.